Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes illustrating the value and getting a clear view of one of our partners in the Medicare Advantage space that we feel can be advantageous for you to market, have as part of your portfolio, and utilize the different advantages and tools that ClearSpring Health brings to you as an agent working in the Medicare space. Today's presentation will be recorded, is being recorded, and will be made available on our website at premiersmi.com and on our YouTube channel as well. So you have the opportunity to review it. Plus, the link will be available through your agent marketer or your agent success manager, your marketer within Premier as well. If you don't have one of those yet, we're going to help you get one. As I mentioned too, 50 to 60 minutes, gee, John, that's a little long. The mind can absorb what the butt can endure kind of type of thinking here. But what we want to do is give you a little different view of this carrier and some of the things that kind of differentiates it when it comes to delivery of the benefits. And we want to make certain that this isn't one of those, oh my goodness, in this market, I have a copayment of $5. It's not that kind of scenario with us here today. We're looking to do some of the things that are, well, for want of a better term, when we deal with the Medicare Advantage market, different pain points that come as part of the delivery of these programs. It will be directed to a range of different agents. So for some folks, it might appear to be a bit remedial. For others, it might be a review, a welcome review of program intricacies that help us market. And for some folks, it might be a first glance at this carrier's attributes that help us. So we're going to do a number of things that are going to get a bit of a level set for us. And we'll start with a level set about who's Premier Marketing. I look at the attendees today. I recognize some names, some I don't. So, hey, Premier is a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states with insurance services available through independent insurance agents such as yourself in a relationship that's facilitated by contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. And we do so through a full portfolio of products. ClearSpring is an illustration of the offerings that we have in the Medicare Advantage space, but we also offer a number of Medicare Supplement and standalone Part D prescription drug plans, but also a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits aimed at those particular pain points that folks have in their coverages to make certain that we're able to address those specifically. When we look at Medicare Advantage, we have the national carriers available to you. Many of the strong regionals, such as what we'll discuss today, are available as well. A multitude of different programs that help support you in the selling of these programs and making certain that we're doing so in a fashion that adheres to all the regulations that are out there, but also enables us to do so effectively throughout the year. The prescription drug plans, those standalone Part D programs, most of these come as part of the contract that you have with the carriers, the Medicare Advantage carriers. In this area, however, there's a couple of exceptions. Mutual of Omaha is a separate addendum than any of their other contracts. It's only for their prescription drug program. And CleverRx is actually a discount program and not a Part D plan. Those Medicare supplements I alluded to, well, we want to make certain that we have choices across the board for the population we serve. And so you have a broad portfolio of Medicare supplement plans, the marketing initiatives they bring to us, the additional incentives that they make available to us. We want to make certain that you have those and are able to address the needs of the entire Medicare population. With that same mindset in mind, then how do we deal with perhaps holes in different coverages or specific needs for a particular benefit that's out there? I need help with or I'm looking for help with cancer plans or critical illness programs. I need additional dental, vision, hearing programs above what's available with my Medicare Advantage program and aren't anything other than a discount plan with my MedSup. We make certain that these are available for a number of reasons. One, to specifically address those needs. Two, to give us additional marketing opportunities because they are regulated differently than some of the base programs. Not that we want to be sneaky or anything about it. We want to make certain, however, that we're able to open a door to a discussion with folks based on their hot button. And of course, it does also give us additional revenue streams for ourselves and our agency, because that's important when we look at a broad market. When we're looking at the Medicare market, you hear the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. When you look at the overall market based just on age, they're exponential growth. However, we have some caveats to that. There are some folks that are eligible for Medicare benefits and aren't accessing them all when they're immediately available for one reason or another. Let's face it, the pandemic played devil's advocate with some retirement plans. So some folks have postponed their retirement. They're continuing to work, looking to see if they can't regain some of the monies that were lost because of some of the challenges in our society over the last couple, 2-3 years. There are also folks that, hey, I just enjoy working. And then, of course, for whatever other reason may come into play. So it tempers that number just a little bit, but it's more than made up for by the folks that are under the age of 65 accessing Medicare benefits because of disability. These folks are great prospects and great folks in need of Medicare Advantage plans because, hey, the benefits are the same no matter what your age is, and you don't have to be underwritten for them. So we want to make certain that we have the programs that address this population because it's friggin' huge. Look at these numbers from CMS. Over 65 million people enrolled in Medicare, huge market. We need to address it. And, pardon me, we need to be prepared with programs that help people, whatever their base choice is. Because, you know, you go into Medicare, you don't have to do anything. You can even decline Part B, which is a viable choice if you're working past the age of 65 and you have creditable coverage, so you can avoid a penalty. But there are some folks that will take B, look at the shortfall in the total coverage with traditional Medicare, self-insure for that, maybe pick up a standalone Part D plan for the medications, or they'll address the deductibles and coinsurance with traditional Medicare through a standardized, modernized MedSup and a Part D program, or look to bundle through the Medicare Advantage programs that are being hawked a little bit on television ad nauseum, which makes our life a little interesting to explain why this conglomerate plan isn't available in this market. However, the advantages can be really huge for folks, and we demonstrate that with the offerings that we have with the different carriers that are available in our target markets. We do so throughout the year because it's a need. We have the opportunity to help people throughout the year, even though we're past the annual election period, but we need to address that because look at that. 70% of the people on Medicare didn't really compare their plans during the open enrollment period, during the annual election period, and they need our help. And a lot of them come to that realization when they go to access their benefits. Golly, the copayment for this changed for hospitalization. More often than not, I'm going in to pick up my meds. I pay differently. Why is that? Well, you didn't do a plan comparison. We didn't look to the different programs that are out there, regardless of your base coverage, particularly on medications. We still have the option to do so and explain it in a language that people understand. Ton of acronyms in the Medicare space. This is a screenshot from the CMS website, obviously. 4,420 acronyms. Good golly, Miss Molly, that's a lot to try to decipher. Sometimes we need help with it, but it gives us the opportunity to explain what these different letterings mean, and we're able then to properly explain the program's benefits and how they can help people throughout the year. And we do that because all the programs that are out there, well, gee, they didn't, 70% of the population didn't review it. Well, they're not using the tools that are out there, put out there by the government. That's a huge thing. You know, it's like, okay, I'm assuming that the regulations stayed the same. I'm assuming that the program stayed the same. So I'm not really reading through my Medicare and You book, no matter if I get it electronically or mailed to me. I'm not using online tools to see what's covered and what is not. I'm not looking at the different recordings that can help me understand my benefits and how I can improve them. So, as independent agents, we want to make certain that we're able to deliver that information in a manner in which our target audience can understand. Sometimes that means delivering it in person. Sometimes that means sending it electronically so they can understand it. And that lovely marriage in between, we're hybrids, where we need to make certain through whatever communication channel we need to use that our folks understand the benefits and the specifics of the different programs we have in play. And let's face it, that whole expectation of, oh, gee, seniors don't use the internet. Horse Bucky, as they used to say on the MASH unit TV show. We've trained them. We being the whole population that serves the population in whole. I mean, for a great period of time, a doctor's visit was virtual. Be it a primary care specialist. A lot of the prep work still is virtual. A lot of the prep work for a hospital stay or a visit to the dentist is all done electronically. And hey, it affects other factors that affects our lives. Our services for our worshiping our faith through our faith beliefs, that sort of thing. It is all a factor in the consciousness of being raised within the population we serve and how they are more digitally savvy, because we have to explain these different election periods. We have to explain to folks that, hey, even though we're past the annual election period that ended on Pearl Harbor Day, we have the OEP, which we can't actively market, but we can look at and utilize if they bring it up. But we have all these special election periods that affect the majority of people that are on Medicare for one reason or another. They're not affected by some of these standard SEPs. They're affected by the special election periods. And that gives us the opportunity to take advantage of some of the communications that come into play where the carriers are helping us recognize we have specific opportunities in specific markets. And this really does help us. So it behooves us to actually read our emails that we're flooded with, because there's valuable information in there as to why we want to make certain that we know there's an opportunity in our target market. So we want to make certain that we get a clear view of the programs and the options that are there for us. And we do that with a little bit of a different presentation with ClearSpring Health. ClearSpring has invested a great amount of money in the different support for agents within their organization. So a ton of different people that can really help you in your specific market. And it behooves us to work with the agent managers that have the tools that help us be successful in different markets. And they then can help us with specifics as to plans that may not show up on, okay, here's a panel comparison of this carrier versus this one. What are we going to look at? Well, we're going to take a peek at some of the things that affect those choices. And that includes one of the main factors, which is a go or no for a managed care program, and that's the network. How do we look at that, and how do the different carriers address that? With ClearSpring, they give us some information on the different markets, specifically with the network. So we have an idea as to what the highlights are of the different partners in the different areas. So here in Colorado, we realize that, hey, we got a pretty strong market when it comes to the ability to access the care. And that goes back to, you can have a lovely looking car. If you don't have gasoline to fuel it so you can drive it, doesn't do you much good. That analogy translating over into a Medicare Advantage plan is, do we have the folks that can deliver upon the care of the benefits that are shown within the program itself. So that information in Colorado is available to us. That information then gives us a piece that goes beyond just the network, the strengths. It's the whole Clint Eastwood movie, the good, the bad, and the ugly. We need to know what is there and what is not, and how we can address the questions that come up in that circumstance. Back in the 90s, when I first started selling Medicare Plus choice plans here in North Texas, in a 13-county area, we had less than 200 docs total, primary care and specialists. And this is the largest insurance carrier offering these programs. How do we address that? How do we make certain that folks realize that that can actually, a change in some of that delivery system can make a difference, because it's a different set of eyes on the program. We aren't the whole, well, we did that last year, we don't need to do it now. You know what? When it comes to your health and the changes that come about in our body, yeah, we do. We need to make certain that we can take care of that situation. So it gives us that information then on the contacts within the network, how we can address the needs in our target markets, and moving beyond Colorado, how's that look in Georgia? Is that same scenario there for us? How can we make certain that it takes care of not just regular, for want of a better term, Medicare Advantage plans? How does that work with the special needs programs that can make such a difference to the vulnerable populations within Medicare? Those programs also come with one of those lovely special election periods that allow us to market year round. Two little distinct markets in the special needs plan arena, a little bit of a different audience, obviously, but it gives us then the idea as to, gee, how do we make certain that the care that is promised to you through the plan is delivered through the providers that are available? And that gives us then that information to explain properly and how that can work to the advantage of the folks that we are enrolling in the program. And you look at some of the folks that are there available to us within the market. Hey, we got access to folks that help us understand the breadth and depth of a network with Clear Spring Health. And that includes going into the great state of Illinois, where things are a little bit different. The way that Illinois handles some different things, no formal D-SNPs that are there. How do we address the different segments of the population because of that then, and make certain that they know what providers are available to them? And we want to make certain that we're able to do that. North Carolina, the same sort of thing. What are some of the networks and the strengths that we can bring into that market, and how can we address that particular target that's part of our marketing program? South Carolina, same sort of information. So we know how we can play in that area profitably, compliantly, and effectively. That makes a huge difference for us. And that can be a great help for us, and a little bit of a different perspective when we look at, gee, do I want to work with these folks? What are they bringing to me? Well, one of the big things is, are we communicating properly when it comes to that information? And that's part of the reason why carriers make information available to you in a little bit different fashion. We're here near the end of January as this presentation is being recorded. We've gone through some of the rollouts. We understand to a degree what the co-payments are and the extra benefits, the social determinant of health things that come into play. How then can we take that and translate it into the delivery system here in the great state of Virginia? It can make a huge difference for us as to how that works. And we then also want to go beyond that and make certain that we address the needs of folks where this is the benefit that most people access most frequently. So how are their medications covered? How does that work with the prescriptions that are being prescribed, the new legislation that comes down as to cost of co-payments for certain medications? A big talk all over the market as to how do we cover insulin for diabetics? How do we work with the max copay that the government has put on there? And then also look at, gee, what are the medications that are actually covered? Because when we look at that legislation, it speaks to what can be charged. It doesn't necessarily say what medications are part of the formulary, how they are handled. And we want to make certain that, particularly when we look at this vulnerable population, and a population in many markets that qualifies for a chronic special needs program, one of the qualifying factors in most cases being diabetes, how do we then look at and explain the different coverages that are available to us through the programs that we're offering with Clear Spring Health? How are the premiums affected? And one of the things that we look at when we look at the array of choices that we talked about, well, some folks, they want to, they don't want a network. They want to make certain that we have a Medicare supplement plan with whatever carrier it is. Well, we got to make certain that we have that drug coverage. How then does that work in the different areas when it comes to those PDP programs? And do the plan premiums fall under that benchmark rate where folks that are of lower income receive a subsidy to help with the cost of that plan through LIS, Extra Help, that low income subsidy program? We have programs recorded that help you explain that across the board generically, but we want to make certain that we are below benchmark in every region. You can enroll a person of low income in a PDP program where the premium is above that benchmark, but they're liable for the difference between the plan premium and the benchmark. So we want to make certain that we do our due diligence and we are doing things properly for the audience we serve. And where are those medications available? We talk about network. Most people go, well, gee, that's doctors and hospitals. We got to look beyond that. What pharmacies really come into play? Are there favored pharmacies in a preferred network that really helps with some of these costs? And what we have with ClearSpring is, gee, look at those. Those are the big bangers, the nationals that are available. And we have that function then that can really help through preferred retail pharmacies. We want to totally understand the plan formulary as well, because, okay, the drug's covered, but how? What tier does it fall in? Because that affects what's out of pocket. Are there other requirements for the use of certain medications? Is there step therapy involved? Are there quantity limits for different things? And we want to make certain that we have our duckies in a row when it comes to that. And it gives us then the opportunity to look at, okay, with plan type, is it covered differently with a dual special needs plan? How do we make certain that we're addressing the specifics that folks have when they go to access their care? ClearSpring Health gives us that drug pricing tool that helps us understand where medications fall within that formulary and how we can minimize cost for individuals. As a person with, unfortunately, multiple health concerns, we got to look at how we can balance the cost of these medications, adherence to the prescription regimen prescribed for us, and how that works with our budget. And that can be a big difference in the explanation of the program, the understanding of out-of-pocket costs, and limit those bloody surprises. That wasn't really a good adjective to use there, but the sticker shock when we go to pick up medications, and can we pay for it? We want to make certain too that we have support with those questions that pop up that, hey, I don't have the answer. Well, ClearSpring offers a dedicated line to help with those questions when it comes to the benefits, the medications, the copays, the pharmacy network. And it's live to answer broker questions 24/7. So keep in mind, this is being recorded. You have access to that number as an agent contracted with ClearSpring to clear up those questions. We want to make certain that we deliver accurate information as well, and having a resource that helps us answer that makes a big difference. So we want to make certain that we do what we need to do to not only offer the plan, but give the detail as to how it works for the folks that we're dealing with. So can we access those people in the field, the muckety mucks, and the people that are toiling in the field of battle? Yeah, we can. And that's one of the reasons why we like working with ClearSpring, because they offer us that type of support for us as working agents. Going beyond that, why would you want to work with ClearSpring through Premier Marketing? Well, there are some different things that we can do to aid in your efforts as well. I mentioned, and I go back and keep harping about those ancillary benefits. ClearSpring has a wonderful array of additional benefits that address a lot of the social needs that come about. The social determinant of health programs that address specifics that go beyond traditional medical expenses. But sometimes, no matter how good it is, it's not enough. We need more help with dental. We want to address in-hospital costs through a hospital indemnity program. My family has a history of cancer or MS or whatever it happens to be with a critical illness. What can I do to make certain that I'm addressing those needs? Hopefully that never occur. That's the way it is with insurance. You take it out because you don't know. How can I make certain that I'm prepared for that? We have a way for you to contract electronically, create that agent profile within the system so you can then do things as effectively as possible. Let's face it, for some of us that started out with the hammer and chisel days, well, they're long gone. There are carriers out there in different space. They only do things electronically all the way through the system. Contracting process and the application process is all electronic. Our world's changing, has changed, and if we have the tools to do things to accommodate those changes, it makes a big difference. This can do it for you and give you the opportunity to contract as effectively and as efficiently as possible. I had a hard time with that word, didn't I? We also want to make certain that we are covering your possible financial liability through discounted errors and admissions coverage. It says for qualified agents. What's that mean, John? Well, you got a contract with us. But it doesn't limit you to our portfolio of products. Premier Marketing is huge. We have a ton of different programs that are available through a ton of different carriers. We don't have everything. No one does. I don't care what someone's telling you. Nobody has everything everywhere. And in all candor, there are programs out there that they don't market through the broker community. So we need to make certain that we are covered where our financial liability. This is a program you own. It satisfies that requirement with the different carriers, regardless of whom you contract through. We want to make certain that that's available to you. It's discounted if you work just with us, but hey, that's the way it works. We also want to make certain that we keep your license in play through discounted continuing education to address those requirements. And we do so through our relationship with WebCE with discounted continuing education bundles to make certain that that stays available to you. And we make programs available for you to address and enhance your own personal benefit structure. Independent agents, we have to buy our own insurance. It's the way it works. This program is a modified guarantee issue program to protect your ability to earn. So it's a non-cancelable modified issue disability program on which you're paid a commission on a program you take out on yourself. Great way to add to your own benefit structure. I mentioned earlier that today's presentation is being recorded and will be made available on our website and on our YouTube channel. The links there are there for you. But we also have a library of past presentations that are recorded and made available to you. So how do we get in front of people and spread the gospel of the benefits that we have available through the carriers that we work with? How do we work with churches? How do we work with providers? How do we work with centers of influence in the community? How does this program that I've never sold before in an area that I'm not familiar with, how does that work? How does this carrier take care of that? So we look at different programs that are like long-term care programs. Do we have people that can help you in that area? Yep, and you have that information available to you 24/7. We also make available access to an electronic tool that I think is foremost, the premier tool, pun intended, in our Medicare Center program. It's access you have available through a contract with our organization or one of our integrity partners that is available to you without cost. And it's a single login for multiple quoting engines. So you can collect all the information in the Medicare space to stay compliant. And it stores it for you. So that scope of appointment, those call recording capabilities, it's all in there. You think of the space that takes when you're recording an hour-long call or longer or shorter with a prospect or client that's required of you. Well, this is going to take care of that for you, and it then enables you to do a side-by-side plan comparison and do it compliantly. We also want to make certain that it makes available to you additional marketing opportunities. So a Pearl is available to you, a personal URL, which is a microsite where you can direct people to shop through the programs that you offer because you're controlling what's available on that site. They can do their homework, they can enroll. That is your client, that is your commission. It's also important to note that deaf research tells us that there's a whole bunch of people in the Medicare space now that are doing their homework ahead of time before they speak to an agent. This gives you then the opportunity to put a link in your email correspondence on your website so they're shopping through you. And we then have a system that helps us manage those contacts through a CRM that's made available so we can do year-over-year reviews. We can go back and cross-sell throughout the year. We can contact people legitimately because in many circumstances, they may have a switcher tag attached to them. What's a switcher tag? Well, this is the population that is more likely to change coverages. So it gives you a way to prioritize some of your marketing activity, and that's there for you. LeadCENTER, I'm going to talk about in just a moment when we talk about the marketing programs, but this also gives you a way to enhance your sales ability. I don't care how long you're in the business, we can always do better. So we have great programs. We've got a hold of some people, and they want to talk about these programs that are available. Am I enhancing my skills to better my close ratio or to get that appointment? What resources are available to help me there? Well, it's available in the library within this as well, and it's also available as a mobile application. And to steal a line from one of those celebrity endorsers on TV, it's free. No charge to you. If you were to buy this system, man, that's a sizable investment. So it's made available to our contracted agents without cost. We also want to make certain that you realize that there are additional incentives above your commissions with certain products. In the Medicare space, that applies to med sups, but it doesn't apply to MA or PDP programs because max comp for that set by the government, most carriers, including ClearSpring, gives you the highest possible commission level right out of the box. However, some of the other programs will give you additional incentives that might help you qualify for trips that are made available to that carrier if they offer one. And it affects your eligibility for premier incentive programs, including the help with direct mail we'll talk about in a moment, but also the return of our producers convention that was on a bit of a hiatus because of the pandemic. A great extra perk for working with Premier. We also want to get you in front of folks based on different marketing techniques. So you want a cold call? God bless you. We have contact lists available to you that's butted up against do not call that's available to you at low or no cost. We have those programs that I mentioned that are recorded to address community-based marketing programs, getting the full return on your investment on retail marketing. Well, gee, John, I finished up my Walmart campaign on Pearl Harbor Day. No, you didn't. That's a year-round opportunity just by staying in touch and making people aware of it so we get the full return on our investment in those initiatives. How do we approach faith-based organizations? How do we work with providers? They're there. Carriers, particularly in the Medicare Advantage or prescription drug space, may occasionally have generated prospects for you to work as well. But this is a quid pro quo situation. You're scratching their back after they scratch yours or vice versa. We want to make certain that you are in tune with the support, the feet on the street that I referenced earlier that can make a difference for you marketing carriers in your target market. We do offer internet leads, direct mail support, LeadCENTER I'm going to go into. We're going to talk about these other ones in a little bit of detail in just a second. That direct mail program is based on production, but it drives down the cost of direct mail so you can do so consistently. Because direct mail is kind of like an exercise program. You do it once, you might feel good about it, might cause you a little bit of pain, but you don't see all the results that you would if you did it consistently. And we offer that support for both health programs and final expense. So you can qualify for it twice within a month to help drive down the cost of your mailings. And we do so through preferred lead vendors. We vet their systems. We want to make certain that they have the capability to deliver upon those responses in as quickly and as timely a process, because you want them when they're good and hot. We also want to do a review of the letters they're sending out, the correspondence that is raising awareness of the capability you have to serve that population. We want to make certain everything stays compliant yet effective. We also have programs to help fill the holes in your calendar through direct mail responses that are available at different prices throughout the year in different areas. Great way to plug your schedule and make certain that you are seeing enough people to be effective in pursuing the goals that you've set for yourself in our marketing initiatives. Those internet leads, well, our target demographic works a lot on Facebook. So we have Facebook lead programs, one for final expense, one for Medicare. The thing is, that's a microwave lead source. You turn it on, gee, I can get stuff really quickly, but they expect responses really quickly as well. So we want to make certain that we're aware of it and we are set up and prepared to maximize the use of the folks that have raised their hand in this system. LeadCENTER, I've breezed through that twice already, but what this is a program within Medicare Center where you can purchase leads that are sourced from a variety of different areas, internet, direct mail, whatever it happens to be. And you can get them delivered to you as a live transfer or through data put into your database within the CRM within the system. You control the lead flow, you control how much you spend, and hey, there's even sales on these leads in certain areas because we want to make certain that they're delivered in as hot a fashion as possible. So a great way for you to use a key component of a system that's available to you without cost on a continuous basis. Help us be effective throughout the year, us being the agent community. That T65 Locator tool, it's something you download to your smartphone or your smart device, your laptop, your desktop, your iPad, whatever. You register, they see you have a contract with us. It too is available to you without cost. JJ Walker, it's free. And you can set parameters within it and determine within a geographic area, am I effective here? Have I had an appointment cancel? And I can go visit someone based on the geography. You can door knock for certain things. Please, dear God, don't do that for MA or PDP programs, but you can for final expense, you can for dental, you can for Med Sup. It gives us a great way to enhance the prospect flow within our sales funnel. And that is available to you without cost. And we tell you how it works. That referral program I breezed over to, well, this is something that brings into fore the whole bit of when do you ask? How do you ask? How do I make certain that one lead is 7 leads because I asked the right questions? Statistics show that only about 11% of agents actually ask for a referral. Are you one of those, or are you one of the 89 that said, oh man, I forgot to ask? Well, this gives you an opportunity through the prospecting and sales process to add to your lead flow, but it's also a way to make certain that your book of business is engaged. So you can call people that you have access to through your CRM within Medicare Center or whatever system you use and say, hey, as a sample approach, I got a great dental program available in your area. It really helps a lot of people that I've been speaking with. You know people that are in need of such help. You shut up for a moment, which is really hard for me to do, as I've demonstrated here already. Well, yeah, I know someone, me. So it can really help in that fashion as well. And since you're doing an approach with a demand product of that nature and regulated differently than our Medicare space, it can really, really help grow your book of business, solidify it, because hey, statistics show the more product you have in the house, it doesn't matter if it's with the same carrier or not, just has to be with the same agent. That's you. It pushes your percentage of persistency up. Your retention is stronger by having multiple products in the household. We do all this because, hey, we want your business. We want to be referable for you to your agent friends. We want to make certain that all these different programs that we offer with the different carriers that are available through our organization, the different programs, that we are a factor in your success. And because many of these are available very quickly, if you haven't got ClearSpring as part of your portfolio, you've probably done AHIP, you've probably satisfied a whole bunch of the certification process already that they require. How quickly can I contract? How can I get this in play? How can I make certain I understand the programs? How can I establish that relationship with those feet on the street? It gives us that opportunity to put that in play quickly and to kind of satisfy the adage of old John Wayne in the movie The Cowboys, slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. You can put it in play quickly. You can make it work. It can be a crucial factor in your success moving forward. So I'm going to check really quickly on questions. And we're good. So at this point in time, I'm going to do something that is absolutely necessary. And that's the thank you. For folks that have worked with Premier Marketing in the past, we thank you for that business. We hope to enhance that relationship through the programs that we offer with carriers such as ClearSpring and the opportunities that they present in different markets. Thank you. We sincerely appreciate the business. For those of you that are investigating us as a potential partner moving forward, thank you for that opportunity. We look to serve you as well and make certain that you have a subject matter expert, an agent success manager within our organization that can help you with the needs that you perceive and the opportunities that we can present as well. But for everybody who has viewed this presentation, I want to thank you for spending your most valuable resource with us here today, and that is the time you took to participate in this presentation and to listen to me blather on. Thank you. We appreciate that opportunity as well. So until we're able to see you on additional presentations we have a slate of different webinars available for you, different trainings that are there, discussions we may have in the future. Until the time that happens, I'm going to wish you good selling. Thank you very much. We look forward to speaking with you very soon.